Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is what you need to know about arthritis in your joints. Arthritis is the number one leading cause of disability in this country, with over 50 million Americans being affected. It involves inflammation of one or more of your joints, with the main symptoms being joint pain, stiffness, and typically it gets worse as one ages. There are two main types, osteoarthritis and rheumatoid arthritis, with a significant amount of lesser ones as well. Osteoarthritis involves wear and tear, degenerative disease. It causes cartilage to break down. You still make cartilage at the same rate you did when you were younger. You just break it down faster. Rheumatoid arthritis is an autoimmune disease that targets the lining of the joints, and there's other types which are less common, psoriatic arthritis, lupus, and crystalline, such as gout. Why does arthritis occur? Well, as I mentioned with osteoarthritis, it's a ratio problem. You're still making cartilage at the same rate as you were before, but you're losing it faster, so it becomes a ratio problem. With rheumatoid arthritis, it's an autoimmune disease. It targets the lining of the joint. It is not hereditary. More women are involved than men, and the immune system just makes antibodies against tissues in your own body. Risk factors for arthritis include family history of it, increasing age, females more than males for rheumatoid, males greater than females for gouty arthritis, post-traumatic, or obesity. The symptoms of arthritis are going to vary between individuals. It can include pain, stiffness, swelling, decreased range of motion, and just because arthritis shows up on an x-ray or MRI doesn't mean you're going to have any symptoms. It doesn't always correlate with your imaging studies. The treatment options for arthritis, there are quite a few, thankfully. The first is activity avoidance. If it hurts, you don't have to do it, or just do it less, such as if you're playing golf 5 days a week, maybe cut back to 3. If you're active with running, switch over to bicycling or swimming. Medications that are available include oral and topical, either over-the-counter or prescription medications. This may include, for acute exacerbations, opiates. Bracing or a cane. Actually, a cane, if you have knee arthritis or hip arthritis, can help take over 50% of the pressure off of your arthritic joint. Physical therapy and chiropractic treatment can really help because that can actually strengthen up the muscles around the affected joint and relieve pressure and pain. Acupuncture and TENS units have been shown to offer excellent relief for arthritic joints. Interventional treatments, there are quite a few of these as well. The various types of injections include steroid injections. It's usually cortisone, and these have been shown to provide potentially months of pain relief at a time. Hyaluronic acid is Synvisc or Orthovisc. They help dramatically, over 65% of patients up to a year. Prolotherapy injections, PRP and stem cell injections. PRP is platelet-rich plasma, and stem cell injections involve regenerative medicine. These offer the potential to regenerate and repair arthritis. The smaller studies are showing that this is the case. We do need some larger studies, though, to definitively show this. Radiofrequency ablation is an excellent procedure that can give 6 to 18 months of pain relief for plenty of joints, one of which is the facet joints of the neck or back. It's been a revolutionary procedure. The outcomes with non-operative arthritis treatment, the vast majority of patients are able to avoid surgery or delay it. Okay, so if you're looking at a knee or hip replacement, it may be that you can wait months, years, even a decade with appropriate non-operative pain management. Joint replacements are not meant to last forever. They are a quality of life procedure, so it may be that non-operative treatments get you to a point where you may never need a revision of a joint replacement. Success rates with steroid, hyaluronic acid, and regenerative medicine injections are over 75%. Radiofrequency ablation for your spinal joints has a good to excellent results of over 80%. A large study recently on topical pain cream showed them to be 83% effective. Thankfully, this is not a deadly disease. No one died from arthritis, thankfully. The top pain management clinics in Washington are with the Washington Pain Network. They have multiple clinics throughout Washington, accepting over 50 insurances and offering over 25 treatment options. The success rates overall average over 90%, with the board-certified award-winning pain doctors Visit us online today at WashingtonPainNetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.